Good afternoon, everyone. Welcome to our forum. At this time, I would like to let you know that our forum is being recorded this afternoon, and I'd like to introduce State Representative Todd Hunter.
Thanks a lot, Scott, Dr. Ella. We appreciate all that you've done. I want to thank you for all your work and efforts on this important topic. And, you know, the great thing about this conference, everybody that's plugged in, is it's been community-based. Our community has really stepped up and done a lot of good positive. And, you know, the one thing I want everybody to know is to thank the Coastal Bend for being one of the leaders in the state in doing everything we can to promote suicide education and prevention. And we have done a lot of good things, and I want to thank the community. They've done a really, really great job. One of our objectives with this conference is to engage education, business, and nonprofit organization leaders around issues of mental health, depression, suicide. And we also want to identify actionable approaches. That's action, take action within each sector. That's education, business, and nonprofit. So our goal is, of course, education prevention, but we're also getting organized to go into this legislative session to really, really make a difference. So I want to thank everybody, welcome everybody. And this is a great positive teleconference. This is shining light into darkness. And so we're going to kick right off with one of our speakers who's just told us that she's a native Corpus Christian. So we're glad to have her. And it's my honor to introduce Dr. Courtney Harvey. Dr. Harvey holds a Doctor of Philosophy in Counselor Education and Supervision from Texas A&M University, Corpus Christi. Dr. Harvey has worked for the Health and Human Services for 7 years, managing crisis and jail diversion services as the forensic director, and now Associate Commissioner of the Office of Mental Health Coordination. The Office of Mental Health Coordination is responsible for statewide coordination of mental health services through collaboration with local and federal partners and 23 state agencies, state universities, and judicial offices that receive behavioral health funding to develop and ensure a coordinated and strategic approach to the delivery of these services. She also chairs the statewide Behavioral Health Coordinating Council. So welcome home, and we turn it over to you, Dr. Courtney Harvey.
Thank you so very much, Representative Hunter. I am very pleased to be here today. As Representative Hunter mentioned, I am a native Corpus Christian. And so Corpus Christi is where my nieces and nephews go to school. It's where my mother-in-law, sisters and brothers, where they work. And so it's always good to see great work that is being done in your home community. So I'm very pleased to be here to talk with you today. I'm also very pleased to be here and speak with you today about suicide prevention. That is an area that is near and dear to the hearts of the people that work in my office, the Office of Mental Health Coordination. For the Health and Human Services Commission, we actually have in my office a suicide prevention team comprised of several team members, some of which are here with me today, and some of which I think you've probably heard from before. We have Jenna Heiss, who is our state suicide prevention coordinator, which I think many of you know. We have a suicide safe care coordinator. Her name is Tammy Weppelman. We have Jennifer Heusler-Gehring, who is actually on the call with us today. She is our suicide prevention policy and outcomes coordinator. We have Jennifer Krustinger, who oversees our suicide prevention youth grant. We call it Resilient Youth, Strengthening Environments. We have Laura Gold, who's with us today. She is our suicide care and project aware coordinator, which is a federal grant program that we co-implement with the Texas Education Agency. And we are also in my office tasked with looking at suicide prevention across the service member, veterans, and family member population. And that is led by Dr. Ehab Mustafa. So again, this is something that is very near and dear to our hearts. House Bill 3980 of the 86th legislative session directed two things. It directed for the Health and Human Services Commission, in collaboration with the Department of State Health Services and in partnership with local collaboratives, to take a look at suicide prevention trends in Texas. And we recently, a few months ago, published an agency report with data on suicide trends. It also caused the statewide Behavioral Health Coordinating Council directed that we as a body develop a report that provides detailed information around suicide prevention policies that are in place across the 23 state agencies that receive state funding for mental health and substance use disorder services. So that report is actually going to be published sometime soon if it's not published already. Laura Gold and Jennifer Heusler-Gehring are here with me to answer any specific questions that you may have about those particular reports, because really and truly, they are the individuals that put pen to paper in writing those reports. But what I want to do is provide you with some of the key takeaways that we observed in working with our local partners to develop those reports. And so I'll start with some overarching data. Major findings that we were able to unearth is that veterans are twice as likely to have died by suicide. This number rose by 32% between 2005 and 2017. We saw that youth high school students, their rate of attempted suicide is 66% higher than the national rate. I'll repeat that. Youth high school students' attempted rate of suicide, we found is 66% higher than the national rate. We found that people who identify as LGBTQ are 4.5 times more likely to attempt suicide. We found that for people that are living in non-metro areas, that they are 30 to 45% more likely to have died by suicide than Texans who live in metro areas. I would say that that's a pretty alarming statistic, particularly since we know that 70% of our geography here in Texas is rural. Other findings, we've seen an overall increase in suicide mortality, with the death rate rising over 36% since the year 2000. What it also revealed when we looked across those 23 state agencies that are participating on the statewide Behavioral Health Coordinating Council is that really there is a deficiency of dedicated or sustained funding and a lack of a variety in suicide-related policies and programs across the state that support a comprehensive statewide suicide prevention strategy in Texas from a public health approach. I think the work that you all are doing in this forum, the work that was started with the passing of House Bill HB 3980, the fact that the statewide Behavioral Health Coordinating Council was so alarmed by these statistics that they decided to continue a suicide prevention subcommittee to take a further look into this matter. It just underscores how important this is, particularly in the wake of the pandemic. And we are seeing increased rises in things like depression, anxiety, suicidal ideation. We found that Texas suicide attempt rates for high school students, again, is higher than that national rate by 66%. We found that the rate has increased 37% since Texas began measuring the rate in 2001. So the US rate has decreased in the same time frame, but here in Texas, it's actually increasing since 2001. I will say that, in talking to many of my staff, we see that there are some considerable reasons that it is very difficult to capture suicide as reported locally. I mean, there are all kinds of reasons that it is difficult to capture this kind of data. Chief reason of which I think is probably because there are some negative connotations and outcomes with people dying by suicide. One, when you look at insurance payouts and things of that nature, sometimes that can be complicated when there is a confirmed death by suicide. But I'll say that I think overall, these reports were so beneficial in helping us understand and in underscoring what is happening in the state of Texas, that we are seeing these kinds of increases in suicide prevention. And it is really a call of action in my perspective. In the need for additional mental health resources such that we are able to prevent suicide and really work to get people the timely access to care that they need. We talk often about the role of the local mental health authority and the mental health system, and I think certainly the local mental health authority plays a very critical role. But I think when we are looking at curbing these kinds of statistics, it's going to take community partnerships beyond just that of the local mental health authority, private providers, et cetera. It's going to be a community effort in being able to turn the tide in this regard. And I think Representative Hunter, what you have started, not just with the enrollment of HB 3980, but I also just think these community collaboratives that are coming together, grassroots efforts, are really going to be what is going to work to change that tide. Are there questions? Oh, go ahead. I'm sorry, Scott.
I was just going to say thank you so much for sharing that information. Just really somewhat alarming. I mean, and I certainly think resonates with Representative Hunter's call to action around this topic over 2 years ago. And we are going to have some time for questions and answers at the end of our forum. And so I hope you'll be here to answer those. And I've taken the liberty of trying to follow along with your presentation and enter some comments into the chat, which will be also archived after this. Thank you so much. I hope you'll be here at the end of our afternoon
we will be here. And I will also say another helpful resource is mentalhealthtx.org. It is a website that has been established by the Statewide Behavioral Health Coordinating Council. They've got great information from a statewide perspective on not just mental health, but also substance use disorder resources that can be located when people need assistance. So I'll put a plug in for that as well.
Thank you very much.
Ms. Harvey, that was very reaffirming to hear you, because everybody who served on the task force when this started, it just I guess makes us feel good that, okay, good, we're making progress, and you all realize that House Bill 3980 is really helpful. So thank you so much.
So as we move through my role, I'm Dr. Scott Elliff, and my role in this meeting is to be the moderator, facilitator, and make sure that people get admitted to the room when they show up, and try to keep the whole thing rolling here. And so our process is we're going to hear from Heather Loeb in just a moment. Heather has been sharing some really wonderful personal stories and valuable information on her blog and in her recent columns and continuing columns in the Corpus Christi Caller-Times. Then we're going to move into a time with some breakout sessions. And I will tell you that that may be the point in our afternoon journey together when there'll be a little mid-flight turbulence as you move into those rooms because of the different versions of Zoom that you have. But we'll give you more instructions for that later, and what we need from you in terms of fastening your patient's seatbelts when we get to that section of our meeting. Then we'll come back together for some large group discussion and wrap up as promised right around 3 p.m. So with that, please join me in welcoming Heather Loeb, who's going to share her story with us. And I know that we'll find that to be also very valuable. Heather.
Hi, everybody. My name is Heather Loeb, and I'm a mental health advocate and the creator of Unruly Neurons. It's my blog dedicated to normalizing depression and other mental disorders. I live here in Corpus with my husband and 2 small children. I'd like to thank Representative Hunter for letting me speak and share my story today. I'm so impressed with his dedication to mental health, and I'm very honored to be here. While I'm happy to be here, my anxiety order is not, so bear with me because I am not a public speaker. My story starts when I was in the 7th grade, when I was about 12 years old. Knowing what I know now, I can see that I had depression and anxiety back then, but I didn't know that the dark, obsessive thoughts I had weren't normal. Nobody around me talked about depression. Nobody talked about anxiety. So I just figured everybody went through it, and I would experience these intrusive thoughts like, you're going to die, your family's going to die, something bad is going to happen to you. And I always worried about something happening, and I could never shake that feeling of dread. It was about a decade later before I actually realized that I did have anxiety and depression, and I admitted I needed help. My grandmother had died, we were very close, and it was just the straw that broke the camel's back. At this point, my depression and anxiety were just more of an inconvenience. It wasn't really taking over my life. I did try several medications, but I never felt like anything really worked. I never really felt normal. But life was livable. I just didn't realize it at the time, but I was barely surviving. Years later, things took a turn for the worse for me after I had my 2nd child. Now, after I had my 1st child, I had experienced postpartum depression, so I knew that it was coming again, but I was not ready for how much it would ravage me. I was suicidal, I was depressed, I was so anxious all the time, and I didn't even realize it was anxiety by the way it was manifesting itself. But I was in horrible pain all the time, and I can remember the first time that I wanted to kill myself. I was at my parents' house in Dallas, and they had taken my kids to their lake house a couple of hours away. And I had gotten into an argument with my husband over the phone. And when we hung up, I just wanted to die. I don't know what we were arguing about, but I wanted to die. And I thought, okay, well, I'm going to take these painkillers that are in my parents' room, and I'm going to kill myself. But before I could get to those pills, I kept thinking, I don't want my mom to find my dead body. And it just repeated in my head, my dead body. And I started sobbing, and I thought about how I would be leaving my kids without a mom. And the only thing that I would be leaving them would be my dead body and so much grief. At this point, I was hysterical, and I called my best friend, and she urged me to go to an emergency room, which I did. They assessed me, and they took me to an acute behavioral center where I stayed for about 2 days. After those 2 days, they realized I wasn't a danger to myself, and they released me. I'd like to say that at this point I was fixed and I wasn't ever suicidal again, but nothing had really changed. I was receiving inadequate mental health care in Corpus. I had talked to my doctor and I had asked him to change my meds, but he refused. So after several months of being suicidal over and over again, of abusing my anxiety pills because I just wanted to feel numb from all the pain, I decided to go inpatient at a psychiatric hospital in Houston for 6 weeks. I'm not gonna lie, it was hard. It was hard being away from my babies, but I was taking 6 or 7 benzodiazepines a night. It was very dangerous, and I wasn't living, I was only existing. But at the Menninger Clinic, I started different meds, and I started ECT, or electroconvulsive therapy, that some people may know as shock therapy. And when I left the program, I had a laundry list of new diagnoses, including major depressive disorder, generalized anxiety disorder, avoidant personality disorder, and binge eating disorder. And though my stay at the facility changed me for the better, I still continue to battle suicidal thoughts. And unfortunately for me, it's probably going to be a lifelong struggle. But what has really helped is calling the National Suicide Prevention Lifeline, and of course, having a very strong support system. If I couldn't talk to them openly and without judgment about how I was feeling, I would not be here today. But not everybody has that support system, and not everybody is as lucky. Some lose their battle to suicidal ideation. They leave behind a tidal wave of grief and destruction for their family and friends. And it breaks my heart thinking about the pain that they're in. But I understand it. I understand why they feel like they have to do it. And I get it. And it's not always comfortable talking about when I have wanted to die. But I realize now that I have to keep talking about, because suicide is a topic that we can no longer afford to be silent about. Staying silent only gives power to the stigma and makes it too powerful and too destructive. One thing that I would like to mention is that it's one thing for someone like me who has a diagnosis and a history of mental disorders to be suicidal. But what I think we need to pay special attention to is the fact that almost half of people who die by suicide, about 54%, have no known history of any mental disorder at all. And that is alarming and it's scary. But that's why we have to be able to talk in openly so people can come to their loved ones for support. And one thing I would urge people, if you have a loved one who is struggling or who's in crisis, I would urge you to be totally direct. Say, do you have a plan to die? Is there a gun in the house? Do you want to die now? And just stay with them. Because no matter what, suicide affects anyone regardless of age, gender, and mental health. We also need to do a better job about educating teens, and we have to know the warning signs and create a safe place for them. Because I just saw a report by the CDC saying that suicide rates among 10 to 24-year-olds has increased by 57% from 2007 to 2018. Now that's without COVID numbers. Those don't reflect anything that's happening right now within the pandemic and what teenagers are facing, all the upheaval that they're facing right now. My best friend who works at Cook Children's Hospital in Fort Worth, she told me that in the month of September, they had 37 suicide attempts in their hospital. And that's just crazy to me. I think there are a couple of myths of suicide. One being that you shouldn't talk about it with your children or teens because, it gives them ideas. But I guarantee you, teens today have already been introduced to the concept. They already have thought about dying even. So our job is to help them with their feelings and to help them figure out a good outlet for those feelings and help others when they reach out to them. But I don't mean to scare you with statistics and facts, but we have to act now if we want to curb this trend, because like I said, COVID-19, the effects of COVID-19, they aren't all known and it's going to get worse before it gets better. But here's what we can do now. We can learn the risk factors of suicide. We can learn the warning signs. You can talk openly and without judgment to your loved ones about it. And if they are in crisis, take them to the closest ER. Don't judge. Just listen with compassion and do not leave them alone. I know I get a lot of comments about what I talk about as depressing or even annoying, but I would rather have an annoying friend or annoyed friend than a dead one. So I will not stop talking about it. So be annoying with me. Help us put an end to suicide. Thank you for listening.
Wow. Thank you so much, Heather, for your courage and your vulnerability and your transparency in sharing your story with all of us. I know that we all appreciate it, and you've really helped to set the stage for our conversations for the rest of the day.
Thank you.
And I think we all know that what you just did was not an easy thing to do. So thank you so much. Okay. We're now going to have some breakout discussions. And our discussions are intended to move us into some sector groups. One group is going to be a business group. Another is going to be an education group. And the third is going to be nonprofit and community organizations. So, so you might be thinking about which is the group that you want to go with today. Those are the three choices. You don't get to create another group. So are you an education school person? Are you, and that would include students. Are you here with your I'm a business owner or business leader hat on? Or am I here as a nonprofit community service organization person? Pick one of those. And in just a moment, something should appear on your screen that invites you to choose one of those groups. And some of you may not be able to do that because of the version of Zoom you have, and I will have to assign you to a group. But we're first going to let everyone who can pick a group leave. And then for those who are left, those of you who are left behind, I will work on moving you into the appropriate group. As I said earlier, this is the part of the flight where we may have a little mid-trip turbulence as we get settled in. So buckle up your patience seatbelts, and we'll all eventually land in a group. When you land in a group, it may even be that we land in a group that's not exactly the group you want to be in, but that's okay. It's what's important is that we're all part of the conversation. When you get there, there's going to be a facilitator for your group, and there's going to be a resource person for your group, and some questions are going to appear for your group to discuss. All right. So right now, good Lord willing, and the creek don't rise, you're going to be able to see these options now. And you should be able to choose I see people moving. So are you seeing an opportunity to pick a group? I see some heads nodding. Okay, so go ahead and pick your group and it should take you where you need to go. Yes, I see people moving. That's good. I'm just going to wait and let that settle out for a minute.
When you click on the choose your groups button, it just automatically takes you right.
It should.
Yeah.
Just going to take a few moments.
Scott, I am not seeing anything on my screen. Was I supposed to be in a specific room?
So yeah, so that's why I say some if you don't have the latest greatest version of Zoom, that option might not appear for you, and so I'll have to assign you to a room. Okay. All right. So we're waiting till those people who've been able to kind of get settled in to go, and then we will assign the other. Ooh, it's many people. So so I'm going to just go down this list very quickly. It should take just a couple of minutes, and we'll get everybody set aside. Aaron Palmer, if you'll tell me which group you want to be assigned to.
Nonprofit.
Thank you. Alex Gomez. Education, business, or nonprofit?
I'll do business, please.
Thank you. Amber Rivera. Ana Sanchez Brown.
Nonprofit.
Okay, great. Andrea Kovarik.
I'll do community.
Thank you. Angela Horner.
Nonprofit.
Thank you. Cristiana Romeros.
Business, please.
Thank you. Christopher Martinez. Cindy Garza.
Education.
Great, thank you. Ms. Tobias. Cydia Tobias.
Nonprofit, she's saying.
Okay, great, thank you. Yeah, you have to unmute so I can hear you. Courtney Harvey, where would you like me to send you?
Business.
Sure, that sounds great. Okay, Cynthia Alvarez.
I'm with a nonprofit.
Great. Dotson Lewis.
Community.
Thank you. Ada, we're sending you to education, and I will join you there in just a minute. Won't take too long. Just a few more that we're going through here. Emily Lorenz.
Education, please.
Thank you. Sissy Pettis is going to business. Erin Escagarza.
Nonprofit.
Thank you. Gay White.
Community, please.
Thank you. Ms. Bijarro, Georgina.
Community.
Thank you. Gloria Taylor is going to be going to community, nonprofit. Mhm.
She's going to nonprofit.
Right, nonprofit, yeah. Gustavo Salinas.
Community.
Thank you. Heather Loeb.
I'll take community.
Jackie Millington.
Nonprofit, please.
Thank you. Jason Embry.
Business.
Thank you. Jeanette Salinas. Jennifer Davis.
I don't have to participate.
Well, okay. Jennifer Hauser Gehring.
I'll go to nonprofit.
Okay, thank you. John LaRue. There's two John.
So the
two
one
John.
capital J goes to education, and I don't know
Great.
where lowercase j wants to go.
If I sent you to the wrong one, then just let me know.
We'll
Juan
go to-
Sandoval. Juan Sandoval. Anita Naranjo. Kara Rivas.
Business, please.
Thank you. Kara Wichi.
I'm sorry, this is Anita Naranjo. I'll go to education, please.
Okay, thank you.
Thank you.
Almost done here. Kara Wichi. Kathy Dice. Kathy Ann Dice.
Education.
Okay, thank you. Kayla Burrow. Kelly Addison. Kelly Miller. Christy Phillips.
Nonprofit.
Thank you. Linda Fraser.
Nonprofit.
Thank you. Lisa Martinez.
Nonprofit.
Thank you. Lucy Villarreal.
Education.
Oh, Scott, I see that Kayla Burrow, so she would like nonprofit, please.
Okay, great. And Velda, I'm sending you to business. Is that right?
Thank you.
Yes. Let me go back. And who was that again that needs to be? That was Kayla Burrows
Yes, sir.
to business. Is that correct?
Nonprofit.
Nonprofit. Great. Kelly Addison. Maritza Villa.
Nonprofit.
Thank you. Mike Solis.
Education.
Great. Thanks, Mike. Mona Lisa Vasquez.
Education.
Thank you. Raul Ramos.
Education.
Thank you. Dr. Hammonds.
Education, please.
Thank you. Ms. San Miguel.
Education.
Thank you. Shauna.
Nonprofit.
Hi, Shauna.
Hi.
Sherry Johnson, nonprofit. Is that right? Education. Okay. Yeah. Reading your lips there. Susan Klaus, do you want to go to education or nonprofit, or where do you want to go?
I'm going to go to nonprofit, but before you send me there, could you
Oh.
please send, it looks like, oh, hold on. It looks like Jeanette Salinas Lopez and Jennifer Chapa to education.
Yes. Will do. Okay. Jennifer Chapa, education. Just a few more. Todd Hunter, where do you want to go?
Wherever you put me.
I'm going to send you to business, Todd.
Okay.
Is that okay? Thank you. Theresa Sharpe.
Education.
Thank you. Thank you for being here. Tami Carlson. Kara Witchy. Jennifer Davis. Okay.
Can you hear me, Scott?
Yes. Who's this?
Sorry, my mic wasn't working. This is Kara Witchy. Can you send me to nonprofit?
Sure can. There you go.
Thank you.
You bet. Bye.
Also, this is Tami
Hi,
Carlson.
Tami.
My mic was off. Education, please.
Okay. Have fun. Okay.
Thank you.
Bye-bye.
Bye-bye.
Jennifer Davis, are you here?
We're back.
It's always just a little bit disconcerting when we're zapped back into the big room. And I know that was a very short period of time for us to visit, but such great commentary that we heard within our group in the education sector. And I know there must have been great comments in the other groups as well. In the few minutes we have before we reach our closing time, would anybody like to share any thoughts for the entire group about particular challenges that you're seeing in terms of depression and suicidal ideation, specific needs? I know that Representative Hunter is interested in that, and has been from the beginning of this task force's work. And any things that you're doing, ideas that might be good ones for us to be considered. Open discussion here.
I can go ahead and start out, seeing as we're the local mental health authority. And so within our programs, particularly mine, I do have the crisis teams. And I would say that this is a community issue and probably a statewide issue. So being in the crisis teams, oftentimes we have to refer to inpatient care. And that's one of the things that has become a really big issue and seems to keep being harder and harder to find those inpatient beds. And I think in particular, when you're talking about depression, the shortened stays or their availability to be able to hold these patients when we know that antidepressants probably take longer than most medications to be effective has become an issue.
Thank you, Andrea. Other comments? We've gotten some that said that was clearly not enough time for us to be visiting earlier. It wasn't. It was very short. There's so much to talk about. Other comments?
I just wanted to mention that NCMHID does do mental health first aid, and it is free for educators. Andrea, I'm sorry. Can you give a little bit more information? Are they still doing those mental health first aid online?
Yes, and they actually have adjusted for COVID, so they are providing virtual classes as well. And so for anyone in the education system or higher level of education, those classes are offered free. It doesn't have to be a teacher. It can be anyone from your cafeteria workers, your bus drivers, those people, and it's a class made to help educate people on signs, symptoms, and on those particular age groups and common disorders that you may see depending on age. And so they have different criteria. I think we have law enforcement, we have veteran, youth, adults. So there's several different classes that you can take. But it's a really good resource. You get a lot of good resources out of it. You leave with a lot of good materials, and it's a 3-year certification.
I just want to say that
does that include other community workers that work, other community people that work with, what do you call it? With the general public, right? I'm sorry, Scott.
Oh, that's okay. No, go ahead, Andrea. But yeah, it's not just educators, but it's like, but you were making the point that it's free for educators right now. Is that correct?
Yes. And I think it's an important point because I know at first, like when I was over it, when we were rolling it out, everyone wanted their counselors to take it. And I would really urge you to push those people that don't have any formal education in mental health. So
I just want to say that I did the mental health first aid training thanks to CASA. I did that with CASA. It was so valuable, and I was immediately within the next week able to put that training to work. And so just the way we all need to know how to give the Heimlich maneuver to somebody who is in distress, mental health first aid, everybody should have that training. So what is who do we call? Who does somebody call if they want to know more about that?
So you can actually go on our website, ncmhid.org. And at the top, you'll see the banners, and there's actually one that says mental health first aid where you can go, and it will take you to the website where you can actually register for a class. You can call the instructor and she can give you more information.
Thank you. All right, other comments? Thank you so much for sharing that, Cynthia and Andrea.
Maybe I can share something that I never thought of because I work with children so often, but Gustavo Salinas that works with adult protective services, maybe he wants to talk for himself, but one of the things that he shared was the mental health challenges that are happening with the adults right now. And the challenges he's facing is it's good that I always say foster, that's not right. I work with foster children. Sorry, Gustavo. What he's finding is that many of the adults that are being protected physically from being COVID and being isolated are really struggling to connect and feeling isolated with the mental health. And he shared with us a little bit about just getting the capacity for them to connect via Zoom and things like that. So Gustavo, I don't know if you want to share more about that. So good.
Yes, I was sharing that we don't, APS doesn't particularly study or it's not within our jurisdiction to investigate suicidal ideation. But the fact that we're dealing with a lot of social isolation and mental health issues just because we're trying to protect our seniors and adults with disabilities is that we're trying to find ways to connect with them. And one of the ways, the initiatives that we're trying to do is an initiative called Caring by Calling. So we're getting volunteers to actually pick up the phone and call some of our seniors and say, hey, how are you doing? Just kind of check up on them. Because a lot of them, and what I shared with the group, that they don't either have internet, don't know how to use technology, even if it was something that could be afforded to them. And I shared a personal experience about my mom. Kind of at the beginning of this experience, she's not technically savvy. She didn't even have the technology, but she's jumped on board. She's on Zoom, she's on FaceTime. And so, she's able to connect with family and friends and do her church through Zoom. And so that's really helped her kind of maintain a positive outlook and kind of look forward to learning different things that she thought was not possible. And so if we could connect seniors to that technology and actually make it accessible to them, because a lot of them are on fixed incomes. And so they can't afford an internet bill and they can't afford a tablet or an iPad. And so if there was any way we could connect them to those services and then teach them how to use it, I think that would be valuable for them moving forward.
What a great idea. And that's something that's potentially actionable. Thank you, Gustavo, very much. One last comment. Anybody want to jump in with anything? We've got great stuff going on in the chat here that's going to be, I know, valuable to Representative Hunter as he thinks about what to take back to Austin.
So I can talk about another challenge that we had. I know in our group, we talked a lot about how the suicidal ideations have been related a lot to loss of income, loss of housing, homelessness. And one of the big issues that we're seeing in Nueces County when it comes to LMHA is that there are no places for the homeless to go. A lot of times the shelters are not accepting people. And I mean, like our respite is only running at half capacity, and it's one of the few resources that will help these people coming out of the hospital. So if people are going in because they're having these acute suicidal ideations or attempts, and then they're coming right back out to the streets with nowhere to go. And if that was one of the things that was impacting that, it's almost becoming like a revolving door. We can provide as many skills and resources that we have, but ultimately, if you're living on the streets, you're just thinking about like your Maslow's hierarchy of needs, just survival. And so I think that's something that has become almost like an epidemic here.
Thank you, Andrea. It would be great if we could, we have some high school students here, and it would be great if we could hear if there's one of our high school students that would like to share anything as we wrap up as our final comment today. Any of our student participants?
Don't be shy. It's okay. I know I saw a couple of you on earlier.
And we had one that participated in our group.
Oh, great.
I was just gonna say, my name is Michael Solis. I was with the educational group, and I was basically just explaining to everybody. First of all, I want to thank everybody for letting me speak. It's an amazing opportunity, and there's a lot of amazing people in here with a lot of changes that we can, further in our educational and just in colleges too, just make students and people just, better for the cause. As I was saying, what I was explaining to my educational group was the students right now are basically like fish out of water. And with the gap in generations, with the technology in between us, we're already so much different from the older generations. And so it's making us, the younger group, a lot more disconnected to, our parents and our teachers and things like this. And so for the students, it's basically isolating themselves and keeping their emotions inside. And from all the other stuff going on with inside social media, because that's really what these kids are leaning on these days, because we're always on our phones. We are, adults are too, and we can't just shy away from that. And so basically from social media, cyberbullying, and that just leads on to suicide. You know, these kids get these thoughts and they can be confused and they're scared to talk to their parents, so they're anything just talking to their friends. But I was explaining how we can't expect the students to reach out to us because anything can happen, because it can be anybody. You never know. Like she was explaining to us earlier. I'm sorry, I forgot your name, but the signs can come. There's no medical history, anything like that. So we never know what a student be going through, and they can be just walking the halls of your own school. They can be they can be your student. You can be the counselor of the student, the parent. But it's always important to reach out to the student instead of waiting them to reach out to you before it's too late. That's why it's so important to always look out for any kind of signs. But even if it's not a sign, just check up on your students, see how they've been doing, because we never know about the home life or their situation, anything like that. So that's why I was explaining that it's important for, you know, adults and even students like myself to just reach out, you know, even through social media, just a simple text or just a simple email to their parents, see how they're going. So that's all I'd like to share today.
Thank you. Thank you, Michael. Good job. Appreciate that. We're at our stop time, and we could talk about this, and we need to talk about these issues. We really do. But we've come to the end of our time today. And so what I want you to know before I turn it over to Representative Hunter to close us out is that I will be curating the chat record for us. And I do have everyone's email address that was able to participate today. And so we should be able to send you an email as a follow-up to our session today. The suicide task force, which Dr. Pettis has been co-chairing for the last couple of years. The whole goal, and several folks here, Susan Klaus, the folks who were the facilitators and resource persons for the different breakout groups. The work of that task force convened by Representative Hunter has been to come up with actionable items that he can then think about in terms of legislation in Austin during the next session. And this next session will begin in January. And it was the work of this task force that resulted in the bill that Dr. Harvey spoke about at the very beginning that helped to generate the very compelling data that we heard. So this work is about taking action to address this issue. I think Representative Hunter has said time and time again that this area of the state is at the forefront, and the work that you're participating in and that you're doing today makes a big difference. And so I just want to say thank you to all of you for being here, and particularly to Dr. Harvey, to Heather, and to our facilitators and resource persons for assisting. And Todd, I'll turn it back to you, and then we'll wrap up.
Please follow us on Twitter. Please, please, please. I put it in the chat.
Thank you, Dr. Pettis.
I want to thank Dr. Elliff and Dr. Pettis. They've done a great job. And you know what, everybody? This has been healing. I mean, talking about positivity, this program, because of everybody on this virtual, you've healed, you've cared, and it shows positivity works. Let me just make some brief comments. First, you know, Dr. Elliff and Dr. Pettis have done a great job, and they're going to be co-chairing this. And Angie from my office will be coordinating. So if any of you all are interested, please contact them or get a hold of Angie, and she'll coordinate with Dr. Elliff and Dr. Pettis. And, you know, Heather, that was a courageous story. You connected, and that's the key. Thank you. Thank you for sharing. Angie, thank you for coordinating. You did a great job. Dr. Harvey, we appreciate you. I mean, you're part of the Coastal Bend, Corpus Christi. Ada, Gloria, Velda, Jennifer, Susan, thanks. We've all been doing this together. And you know what? The United Chamber, our businesses were on this call, the universities, our schools. We heard from our students. We're getting everybody involved. The nonprofits have been on. Our health organizations have been on. Our veterans have been on. Our young professionals have been on. It shows that we have a diverse group and that everybody cares. One thing I want you to know, it's not just Coastal Bend on this today. We have a lot of folks across the state, a lot of our friends in Austin. And I know Angie is working with Jason, who was involved with one of our groups, on getting the word out across the state. So making that comment, what are we going to do? We are not stopping. To me, it's pedal to the metal. We save one person, that is worth it. It is shining light in the darkness. If we as the Coastal Bend can generate our engines, we can make a difference not only in this state, but the nation and the world. To me, we have a mission that's positive, a mission that's caring. And so my plan is we're going into the legislative session beginning January 12th through May 31st to bring in laws that are common sense that you have brought forward, and let's make it a reality. So my positive note to you all is this is an action time. Let's make things great and let's show connectivity. There's no better way than bringing a group together, heal, care, and be positive. And I'm so glad this isn't Todd Hunter. This is a family. We are all a family. And let's go forward, as we say in South Texas, mi familia. It's a my family view. And by gosh, we're going to stay connected. Thank you all very much. Scott, if you have any other comments, I give you the amen.
We all just have to wave. Goodbye, everybody. Be safe. Take care of yourself. Wear your masks. Bye-bye.